wanted to introduce our next speaker, who's going to talk about a direct primary care practice model. Dr. Erika Bliss is a practicing family practice physician. She sits on the American Board of Family Practice, which is a very prestigious organization. It's a national organization. It deals with education for family practice and also accreditation. She worked originally at community health centers in King County, which, as you know, has a large proportion of patients with Medicaid or even no insurance. And then she was director of clinical quality at the Caroline Downs Family Medical Center. And most recently has founded Qliance, where she is the director of medical care. Please help me in welcoming Dr. Bliss.
Good morning, everybody. Thank you so much for the opportunity to speak to you today. It's very exciting to be here and to hear about other exciting models of care trying to move healthcare and particularly primary care forward. That's a personal passion of mine and one of the main reasons that I got involved in creating Qliance. So today I'm going to talk to you about Qliance, which is a direct primary care practice, and I'll explain what that means in the course of my talk. Let me see if I can get this up. There we go. First, a little bit about me. Let me back that up for a second. As mentioned, I worked in the community health care system for several years out of residency and was involved in management and quality improvement and all kinds of activities. I had some wonderful opportunities to get a view on how these clinics actually work, how the healthcare system works. And within a very short time, even though I loved the work, loved the patients, the organizations were fantastic, I quickly came to realize that the system was so broken that I was personally going to burn out. And at one point, even just a couple of years into practice, was very seriously considering leaving clinical practice. Very disappointed in how difficult it was to provide the kind of care that I'd been trained to provide. Having 7, maybe 10 minutes face-to-face time with patients if I was going to stay on schedule. Longer if I wanted to get behind schedule and make all of the rest of my patients wait. It's a very depressing, deprofessionalizing experience, and many physicians soldier on under difficult circumstances, but I was finding it was very difficult for me. And the more I understood about how broken the system was, the more difficult it was for me to keep going. Lucky for me, at that moment, a group of us decided to get together and create Qliance, which has completely renewed my passion for primary care and my passion for reforming our healthcare system. And as you can see from Dr. Spencer's talk, there are lots of people out there trying to work on how to create the ideal primary care medical home. We think we have a good solution for that too. So very briefly, I won't spend a lot of time on my next slide because you all know this. This is the painful truth about our healthcare system. Completely in crisis. We spend way too much money. We don't have insurance coverage for everybody for disastrous things that might happen. People have very poor access to care. And the people who do have insurance don't necessarily get great care either. We get terrible results for the amount of money that we spend. This is having a very serious effect on our economy. Our employers are struggling to pay benefits. This year, we're talking to a lot of employers who are facing 15 to 30% increases in their premiums for various reasons, and they can't do it anymore. Physicians' offices are struggling to deal with very cumbersome billing systems in order to get paid. Healthcare costs are hyperinflated. I mean, as you all know, they go up way faster than the rate of inflation in this country, and there are good reasons for that, but not that that should be happening, but we need to get control of that. And underneath all of this, primary care, which is supposed to be the foundation of the system, is just disintegrating. It cannot sustain those kinds of pressures. Additionally, we're facing our aging population, and Medicare is really in trouble. It's already malfunctioning pretty severely, and it's about to get a huge hit as all these folks turn 65. And unfortunately, healthcare reform on the national level is a lot of the same messages that we've been hearing before. I'd just like to spend a couple moments on primary care and why primary care is so important to an effective healthcare system. Here are some, here are some statistics on what primary care can do for us. Primary care is actually sufficient to address up to 90% of the healthcare problems facing any one of us on any given day. If you have initial contact with a primary care provider, rather than any other source of care, you can get up to a 53% reduction in the cost of care. If you get care from a primary care provider, you're less likely to get sick and you're less likely to die. Plain and simple. If you increase the number of primary care physicians per population, 10,000 in this particular study, there's a 6% decrease in all-cause mortality. That's pretty phenomenal when you have to think about the fact that the biggest influence on people's health is actually public health measures. So the next biggest impact on people's health is primary care. This is a dramatic improvement. And many of you may be familiar with the North Carolina Medicaid medical home pilot, which in its first year, just by assigning people to a medical home and providing a little bit of extra money per month per person for care coordination, they were able to save 11% across the Medicaid system in the first year. Pretty dramatic results. However, as you heard from our previous speaker, primary care, which can deliver all these great things to our healthcare system, is suffering. Primary care physicians are leaving practice or cutting back to part-time status. I never understood that until it happened to me. And 2.5 years into practice, after spending 7 years getting trained, I was ready to quit. I didn't want to be a clinician anymore. So if that's happening to me, and I was pretty darn excited about being a primary care physician, imagine what's happening to folks who have families, other obligations, other stressors. They don't want to do this anymore. Primary care physicians who are mentoring students out there are telling them don't go into primary care. It's a losing proposition. In a lot of big groups, primary care is seen as a loss leader. They know they're going to lose money on primary care, but they just want those referrals to the more lucrative parts of the system. And finally, as you may know, primary care residencies are no longer attracting medical school graduates from the U.S. It's really dramatic how small a percentage, in some cases less than 10% of medical students are going into primary care at all. So what's our model? 3 parts of it. The first part is that we are paid directly by patients. That's what the direct model means. Our patients pay us directly for their care. We do not deal with third-party payers. We don't bill insurance. We have opted out of Medicare. Our patients opt out of Medicare with us. They can get Medicare coverage for other parts of their care, but with us, they've opted out. Secondly, we provide care based on a monthly membership fee. We do not do fee for service, and I'll explain more later how that impacts our ability to deliver care. And then the third part of it is we provide exceptional access and eliminate much of the need for patients to access the rest of the care system. So let's talk about insurance for a second. I know some of you are involved in the insurance industry, but let's think about really what insurance was designed to do. Insurance works really well for things that are rare, difficult to predict, extremely expensive, and to be avoided. So think, for example, of fire insurance for your house. You don't want your house to burn down, you hope it doesn't happen, you don't know when it's going to happen, you want to avoid it, and you know when it happens it's really bad and it's going to cost you a lot of money. So you want insurance in case that happens so that you don't get wiped out financially. Same thing for a car accident or a flood or any disastrous event like that.